My name is Kyle Gertner. I'm 32 and I have hemophilia A severe. An easy way to explain what hemophilia is to think of it as dominoes. Um, your body has everybody's body has factors that work together whenever anybody experiences any physical trauma, and they work together to form a clot or what we would perceive as a bruise. It, in my case, I have severe factor 8, so I'm missing my eighth domino. And if you remove a domino from a chain of dominoes, it the process can't be completed. And when I do my treatments, for example, it would be like placing an artificial domino or that domino to complete the chain so that the clotting process can begin. Well, I think almost everyone can kind of relate to what a bleed feels like. It's a severe bruise. So anybody who's ever had a bruise kind of knows what they feel like, but imagine that bruise 10 times worse, um, whether it's in size or painful. Uh, with hemophilia, you have a lot of joint problems, so it would be a bruise that a normal person would have times 10, but in the entire joint. That would be an example of just one bleed. Um, as for actual pain, what I feel, uh, it's usually sharp pain, usually pretty hot, and real achy. It's kind of hard to explain, but it's painful. There's definitely a misconception about hemophilia, which is that I would bleed if I got cut, bleed out and die if I got cut. That's not the case. I have a tattoo, and I've cut myself multiple times. Uh, it's bleeding with hemophilia is more internal than it is external, because when it's external, the air can get to it and help build a clot, but internally, it can sit and bleed. Um, I hate to be cynical, but I just don't believe that there would be a cure. Too much money involved. But as for realistic, almost cures, there's a lot of technology coming out. Um, one being sub-Q injections, such as like what a diabetic would do, and the factor can last upwards of a week. My hopes would be eventually gene therapy could create factor 8 for 30 days plus. I think that would probably be almost as close to a cure as I possibly could imagine. There definitely has been some positives. One would be camp, teaching younger hemophiliacs how to treat themselves properly, and to see them for the first time doing activities that maybe a doctor may say that they shouldn't do, because it was a controlled environment where treatments were readily available in nurses. The second would probably be traveling and meeting a lot of hemophiliacs from around the world, and developing friendships with everybody. Well, definitely there's plenty of negatives. The main would probably be the joint problems that I have now. the usual swelling or bruising and other bleeding episodes. Um, but beyond that, there's negatives such as not getting to spend as much time with friends or family because either I'm in pain or, in the case of when I was younger, I would be admitted in the hospital for several days. Um, as for other things as well, schooling was a big thing, being kind of singled out, be, especially in gym class, because they were worried I was going to get hurt. It definitely was a negative, and also a side negative would be the addiction, being in so much pain all the time. When I did have bleeds, I was prescribed OxyContin, in my case, for 5 years, and it became a problem. And so, yeah, there's definitely negatives. It's changed a lot over the years. When I was younger, I had to do treatment at the hospital, so I would have to sometimes late at night pack up, be admitted. They'd have to call an IV team. Nowadays, it's much easier. I can do it at home, and yeah, it's pretty quick. Maybe 10-15 minutes. Just find a vein, mix my medication, and do a treatment.